Well, mammograms can save lives by finding breast cancer as early as possible. Dr. Christine Wilson is here to talk about the Canadian Breast Cancer Foundation's Go Have One campaign. Thank you so much for being here today.
Thank you for having me.
Now, let's just start with the basics. Who should be going for a mammogram and when?
So all women in British Columbia 40 years and older are eligible to attend the screening mammography program and have a mammogram. So generally we're talking about women who are of average risk. The only exclusions we really have are women who have had breast cancer. They are usually being followed, of course, by their own surveillance program. Women who have implants should have mammograms, again, starting at age 40, but they have diagnostic mammograms. They go to a diagnostic clinic.
Okay. So there's a different type of mammogram.
That's right.
Okay.
Well, it's the same technology, it's just they have more images.
Right.
Makes sense.
So you say 40, but I think everyone was aware of what happened with Angelina Jolie, and she had a lot of work done to sort of help prevent potential cancer. What made that happen earlier than 40 for her?
Yeah.
Angelina Jolie belongs to a small percentage of women who we consider to be of very high risk.
Right.
And these are women who have a mutation that's been identified that is associated with breast cancer, also ovarian cancer. You were asking about that. That's also in these the families.
Okay.
And so these women often start surveillance much earlier than your average risk women. So they start before age 40. And they start at age 30, and they have actually annual mammograms and annual breast MRI. We don't do breast MRI for screening purposes on women of average risk. So Angelina Jolie actually went on to have prophylactic mastectomies, and this is something that women in that group actually think about. Often they will go through the surveillance of the mammograms and the breast MRI for a number of years till they've had their family. And then they may go on to more drastic.
So it's different for everyone, and you should talk to your doctor and figure out what's right for you.
Yeah, that's so important to know your history, to be communicating with your doctor. Now let's talk about the Go Have One campaign itself. If you do want to go have one for the women who are watching, what's the first step? What should they be doing?
They can call 1-844-GO-HAVE-ONE, and you can make an appointment to have a screening mammogram. And that's the most important thing to remember. And that you can call the central office for screening mammography in the province, make an appointment, and they'll give you an appointment for the center closest to you. So these are important things to remember, and we will also, once you get into the system, we'll start sending you reminders.
Right. I'm just interested too. I mean, I'm sure a lot of women it's a scary thing for them. What's it like? Does it hurt? How does it work?
It's very quick. That's the good news.
That's good news.
The bad news is that it is uncomfortable. I wouldn't say it hurts for everyone. There is a bit of discomfort. It's very short, just a few seconds worth of compression, and 2 views, so in 2 different planes each breast, and then you're done and you're out the door.
But certainly better than the alternative, that's for sure. Now, what's interesting about the mammogram versus the self-check, with the mammogram, I know there's an image going around with the campaign. We have it up right here. With the self-exam, you can find something the size of a tangerine, whereas with the mammogram, it's more of the size of an orange seed, so significantly more effective for checking.
Right. The thing about this campaign that really graphically illustrates the difference between what a mammogram can do and what you can do on your own with your self-examination. If you're lucky, you're going to find something the size of an orange, but you may not.
Right, yeah.
The thing about the mammogram is we find cancer early. That's the whole point of screening mammograms. We want to find cancer where it's small, when the options are best for treatment, and when your chance of survival is the best.
Great.
Makes sense.
Well said. Thank you so much, Dr. Christine Wilson. To book a mammogram, just call 1-844-GO-HAVE-ONE, or you can go to gohaveone.com. It will be worth every second. And we'll be right back.